Manhattan chapter and the co-chair for the health committee that's put this program together. We are so excited to bring you such a relevant program. We do have a number of people who have registered. We do understand that Zoom may be having some issues, so there could be some tech issues, and so there may be people who come in a little bit late. So if we could just be a little bit patient, as because we know people will be coming in to joining us for the Zoom. At the end of the day, this is recorded, and so we have it for posterity. We're also going live on Facebook, so our Facebook friends out there, I want to say hello. So all is not lost. So when one technology goes down, there's all sorts of other stuff that we can rely on. Let's talk about what what we can rely on, and then there's things that are very uncertain. And over the last 2 years of the COVID-19 pandemic, researchers and practitioners, like there are experts that will be participating in our panel this evening, have compiled hosts of metrics and information and data to describe the ongoing impact of COVID-19 on children, especially for this, in terms of this event on Black and Brown children. We know that they are disproportionately suffering in terms of academic and social emotional well-being issues. And this will have an immense effect. It has had an immense effect on them and on their life outcomes, and it may continue into the future. So what do we do about it, right? And given that we are having a surge in Omicron, where we thought it might be over and past us, well, maybe not so much, but there's hope and there's plenty of lessons learned. And that's what we're going to focus on today. So we know that, some of the existing, and I'm not stealing anybody's thunder, but we will get into the hindered academic progress of kids, the stress, depression, anxiety, some of the economic setbacks, of course, all within the context of Black and Brown children who are most at risk. But at the end, I hope that we can wrap it up with solutions or plans on how we can keep our children safe and resilient going into the next 6 months. So with that, let me introduce very briefly our esteemed panel. I'm so thrilled to have these folks with us. Sorry. And I'm just going to hit some highlights on the bios. So Dr. Angela Diaz is widely recognized as one of the world's most influential advocates for equity and for adolescent and young adult health. She is an expert on racial health inequities and race's role as a social determinant of health. She is currently the director of, and will be speaking from her role as the Mount Sinai Adolescent Health Center Director, which is a unique program, and she'll talk about that provides comprehensive integrated healthcare to young people at no cost to them. But she was also, don't sleep on Dr. Diaz, she was recently appointed the first Dean of Global Health, Social Justice, and Human Rights at the Icahn School of Medicine at Mount Sinai, and will form global partnerships to advance social justice and human rights through research, training, advocacy, and policy. So thrilled to have Dr. Diaz with us. We also have Malika Elwin, who is a field support liaison, Bronx High School, a superintendent for the New York City Department of Education. Malika is a successful attorney, advocate, and leader with over 20 years of professional experience in the public sector. In her role, she provides programmatic and policy support to the Bronx High School superintendent and helps to establish and maintain a culture focused on student learning, achievement, leadership, teacher development, collaboration, and comprehensive use of data to improve the outcomes for all students. So yes, we will not be just admiring the problem of COVID-19. We actually have people here who are going to deliver some solutions and some creative solutions for us. And by the way, Malika is not just a speaker, she is also a member of the Coalition of 100 Black Women Manhattan chapter. So thank you so much for participating, Malika. And finally, Latoya Hill is a senior policy analyst with Kaiser Family Foundation. When you think about data, what gets measured gets done. Well, you hope. Sometimes, not always so when it comes to our community, but certainly we have people who are working on that. And Latoya is one of them. And it's actually a white paper that she participated in, that she was an author on, that served as an inspiration for some of the session. So she is a Kaiser Family Foundation's Racial Equity and Health Policy. She's part of, Kaiser Family Foundation's Racial Equity and Health Policy Program. And in the role, she does research and analysis on projects related to the intersection of racism and discrimination, social and economic inequities, and health. And prior to that, she was the director of quantitative research at the Virginia Commonwealth University Center on Society and Health, and she has a lot of experience working on several state health programs. So, it's hard to just hit highlights when you have such amazing speakers. I mean, we should probably just all just go now, because we're gonna hear a lot of good information. So without further ado, let me invite Latoya. We're gonna start with the data. She's going to talk through a few of the findings of the Kaiser Family Foundation with us. So Latoya, are you there?
Yes, thank you for that great introduction, and thank you everybody for attending today. I look forward to our discussions, and I have a few quick slides just to go over some of the data points as we talk about racial disparities in COVID-19 impacts for children. So just quickly to give some background, the Kaiser Family Foundation is a national nonprofit, nonpartisan organization, and we're dedicated to providing information and research that helps to inform on health issues that are affecting the nation across a broad range of issues. And we do this by striving to reach a diverse audience, including policymakers, journalists, and the public. Also, just to quickly mention, we are not affiliated with Kaiser Permanente in any way. This is sometimes a point of confusion given our name, so I just want to quickly clarify that before continuing. As mentioned earlier, I'm a senior policy analyst in the Racial Equity and Health Policy Program area, and KFF has been doing research in this area around health and healthcare disparities long before the pandemic began. And this work is focused on providing timely and reliable data to inform and advance efforts to achieve greater health equity. So to dive into the data, we know that the COVID-19 pandemic has not only exposed, but exacerbated the underlying disparities in health and healthcare for Black and Hispanic people in this country. So when we look at national cumulative data over time, what we see for children are persisting disparities in health outcomes related to COVID-19, particularly for Black and Hispanic children. So we know Hispanic children have a higher share of cases compared to their share of the population, and both Black and Hispanic children have a higher share of deaths compared to the population related to COVID-19. We also see that Black and Hispanic children are 2.7 times more likely to experience a COVID-19 associated hospitalization compared to white children. If you could please put yourself on mute. Thank you. Also, when we look at multi-system inflammatory syndrome in children, which is a rare but serious condition that's associated with COVID-19, in which different body parts become inflamed, including the heart, lungs, brain, skin, eyes, and other internal organs, we see that the majority of these patients with this condition have been Hispanic or Black. And we know that ensuring equity in COVID vaccinations among children is one way to help mitigate the disproportionate impacts of COVID-19 and to prevent the widening disparities moving forward. Currently, there's very limited data publicly available to look at vaccination rates among children by race ethnicity. There's no national data available, and only 9 states report these data, and New York is not one of those states. But among the 9 states, we find that vaccination rates are lower for Black children compared to white children in most of the states, while younger Hispanic children had mostly lower rates than white children, but Hispanic children 12 and up and Hispanic children 5 to 18 had similar or higher vaccination rates than white children. Amid the current Omicron variant surge, we see that cases and hospitalizations have increased across the country, including for children. So for the week ending in January 6th, which was last week, we see that over 500,000 children were diagnosed with COVID-19 in the US, which is almost 3 times the number of cases from just 2 weeks before. When you look specifically at New York City, the health department reported a 4-fold increase in COVID hospitalizations between December 5th and the week of December 4th. So if these patterns that we've seen throughout the pandemic persist, it is likely that the surge in cases and hospitalizations due to the Omicron variant will disproportionately impact Black and Hispanic children. The pandemic has adversely impacted children's mental health, social, and economic growth. So what we've seen is that Black and Hispanic children have faced an uneven burden of the social and mental health impacts due to COVID-19. Our survey has found that half of Hispanic parents and 42% of Black parents say their children fell behind academically due to COVID, compared to about a third of white parents. We also find that half of Hispanic parents say one of their children experienced difficulty in concentrating on schoolwork, experienced issues with sleeping and eating, or experienced frequent headaches and stomach aches. And this is compared to only 40% in white parents. We also find that Black and Hispanic parents are more likely to say that their household suffered a job disruption due to childcare needs in the past year of the pandemic, and that this impacted their stress levels and their finances. Also, studies have shown that Black and Hispanic children are more likely to have lost a parent or a caregiver to COVID than white children. So looking at this data, we know that addressing COVID-19 impacts will be key for preventing and the further widening of health disparities. These disparities are not new, and they've been longstanding and persistent for many years, and are symptoms of broader underlying social and economic inequities that are rooted in historic and ongoing racism and discrimination. For example, we see higher rates of obesity, asthma, type 2 diabetes, and hypertension among Black and Hispanic children. And we know that Black and Hispanic children are more likely to be in poverty or live in a household with someone who's an essential worker, all of which are possible risk factors for COVID-19 infection. With these increased attention to disparities, it's an important time for action to advocate and advance equity by prioritizing equity across the sectors. So not just looking at health, but in looking at education and housing, to name a few, as we know that all of these factors are correlated and work together. Also, by supporting communities and directing resources to programs that advance equity, and prioritizing the collection of comprehensive and quality data, and establishing measurable goals to track progress towards equity, we can begin to track not only our progress, but to advance our efforts in reducing inequities. And that is just a brief look at the data. And with that, I look forward to our conversation about COVID-19 inequities for Black and Hispanic children. Thank you.
Okay, glad if I'm on mute button. That was fantastic. Thank you for helping us to tee up with some great data and information, and serving as I think a good launch pad for more of the conversation that we're going to have. And I want to move now to thinking about those who have worked directly in the field with this and one-on-one with patients and children. And for that, clearly we have, our other two experts. So I'm just gonna go ahead and ask Dr. Diaz if you are on and available to talk about what you're seeing at the Adolescent Health Center. Tell us a little bit about that work, the center and your work and what you've seen.
Thanks so much, and thank you for having me. So I want to start just by describing the Mount Sinai Adolescent Health Center, which is located at 320 East 94th Street between 1st and 2nd Avenue in Manhattan, where young people come from all over the city. And at present, we have 38,000 patients and serve more than 12,000 young people ages 10 to 26 every year with comprehensive medical services, sexual and reproductive health, behavior and mental health, and much more. And 94% of our youth are Black and brown. All those services are provided at no cost to the patient, most of whom do not have health insurance. And we pay for all the labs, most of their medication, and give them Metro cards for transportation. So we really want to have a program without barriers. When the COVID-19 pandemic began, it became clear to us that most services to young people in New York City were going to close their doors for in-person services. So we decided that it was very important for the Mount Sinai Adolescent Health Center to remain open during the pandemic, because not only were young people going to have the ongoing needs that they had before the pandemic, but probably additional needs due to the impact of the trifecta of the pandemic, the financial crisis, and the racial reckoning that became front and center with the murder of George Floyd. We remain open for in-person services Monday through Saturday and had a physician on call on Sundays and at night so that the young people had access to us 24/7. Then we decided that we wanted to learn from the young people themselves how the pandemic was impacting them. So in May 2020, we started to do a monthly survey. And what we learned from them was that 68% reported that they have financial needs in the house. They really had major losses. People had lost their job or had lost hours of employment. So they were having major financial issues. 67% developed significant anxiety. 37% reported depression. 33%, 1/3, said they lost a loved one. That's a huge loss. Sometimes they lost the only parent they had. 21% reported food insecurity. And the young people that were not living with a parent or guardian experienced more or higher food insecurity. And 10% reported experiencing sexual abuse, sex trafficking, and interpersonal violence. They also share with us that the marijuana use increased from about 45% to 61%. And also there was increase in how the young people were finding relationships. For example, before the pandemic, about 4% of our youth found relationships through social media. During the shelter in place, it was more than 20%. So the first thing that we did when we decided to stay open during the pandemic was that we sent a blast communication to our young people saying, please stay safe, stay at home. But if you need us, we are open, we are here for you. Having the clinic open for in-person services during the pandemic was extremely helpful to young people. They told us how much they appreciated that they were had a place that they were familiar with, where they felt taken care of, to come when they were sick and they needed essential services. It may have been family planning or antibiotics, whatever they needed, they could come here and get it with us. In a place where they feel welcome, respected, connected, safe, and not judged. We have a large mental health program with social workers, psychologists, and psychiatrists. And when we saw the result of the survey that we did with the youth with the increased anxiety and depression, we decided to expand the program to add another 10 staff but the need has been so immense that we are not able to keep up. It has been really, really hard. And the young people have the option to get all their services, especially the mental health, either in person or via telehealth. But what we are discovered, especially at the peak of the pandemic, was that sometimes the young people didn't have the privacy because many of the relatives were at home, or they didn't have the video technology, and they had to go with their iPhone to the bathroom in order to have some privacy. The shelter in place gave young people the opportunity to spend more time at home with family. So there were positive aspects of it in that sense. And also to receive telehealth that for some youth, especially if they live far, it was easier. As we know, school were closed, and for some youth, that was a blessing. But the truth of the matter is that many of the youth, the young people, really missed the social network from schools and the rituals of proms, graduations, attending college, and the opportunity to do volunteer and internship at different places. Where do we go from here? I think it is important for parents, service providers, educators, government policymakers, advocates, and others to really realize and understand the profound impact that the COVID-19 pandemic has had in young people, and to make sure to support them, invest in them, and recognize young people's many contributions, courage, strength, and resilience. In healthcare, we need to really make sure that we address the sense of loss and grief that the young people are feeling, provide them the services that they need in a way that they can utilize them, services that have no barriers, that are culturally grounded and high quality. And just to end, not only do we serve young people for this type of services, but we also understood the power of young people communicating to one another. So we decided to create a You Are Not Alone campaign during the COVID-19 pandemic, because people were feeling sometimes isolated and alone. So with either staff or youth talking to other people, to the public. And we also created a COVID-19 vaccination pad to make it easier for our children, for our youth to really get vaccinated, and ask them to help spread the word and talk to other youth about their experience. And I'm just in closing, we need to capitalize on everything that we learned from the pandemic, and not just build back, but build back much better, and really use the innovation that we learn as we move forward. Thank you.
Fantastic. Thank you so much for bringing that, making that so real for us, Dr. Diaz. I have a question just around, in the innovation that you talked about. So you did speak to, the telehealth piece. Is there other innovation we can think about or consider? Is there stuff that's worked that we should be thinking about for kids? I mean, it's the idea of getting behavioral and mental health to kids is innovative in and of itself. I mean, just trying to get that right, that piece right, is going to take a lot of organization. But are there other things that you've been thinking about or that seem to work?
No, one of the things that we have done with mental health, like we have a tradition, we had mental health for 50 years. Mm-hmm. And as I said, the majority of our youth are Black and brown. And we had figured out how to give them the services in a way that they come, and we have thousands of youth getting mental health. But at one point, I realized maybe a while back that the traditional mental health approach of coming for an intake, and assigning a therapist, and having to come the same day of the week at a specific time didn't work for every kid, especially if they are homeless, if they don't have the family structure, if they are being trafficked and things like that. So we developed an innovation where we have mental health staff working together with the medical staff with flexible schedule. So I'm trained medically. So when I see my youth, if I see that they can benefit from mental health right then and there, they get seen by a mental health provider. I don't even have to say to them, I'm referring you to mental health. I say, so-and-so is my colleague, we are working together, and the kid get their mental health thing every time that they come until we help them heal and do better. We see a lot of trauma also, so we are very trauma informed. So there are different ways. It's really thinking of services from the perspective of the consumer, of the young person, and design it after asking them what is going to facilitate them coming and what are barriers that are going to keep them out, and then really making the services in a way that make it easy for them. We call it team friendly, or patient center, all that type of things.
All the buzzwords, right, that are out there in healthcare that mean nothing to other people,
Yeah.
but it's, can you get a culturally competent visit? Can you get someone to help you navigate the healthcare system? And are they, right, do they really see you, right, as a person? And I can imagine for our youth, that's hugely important.
And the other thing that I just want to add quickly, also, I realized that for the young people love their provider, their mental health provider, regardless of who they are. But I realized that I needed to have a very diverse staff that represented the youth, so that not only they get the care, but they see themselves reflected in possibility. They see people that look like them in all type of profession or different roles, and the youth then can use that as inspiration and validity that that's a possibility for them.
That's right. It's all about exposure, right? Absolutely. But I'm going to turn it over to Malika now, because we did, we've talked about the healthcare experience of these kids, and I'd love to get into, there's this all works together. They bring a lot of that social, emotional, and well-being issues into the schools, into the education setting. And if Malika will join us and offer comments on this topic.
Sure. So, during the first wave of the pandemic, when we closed schools to try to keep everyone as safe as possible, what happens when you close schools is that you cut off a lot of the social emotional connections that students have, right? And so you can think about it on several different levels, right? So what we saw initially was, students didn't have access to devices. And so if you don't have an access to a device, how can you do learning at home, right? So there was this great push to get students devices, right? But once you get a device in the student's hand, you also have to make sure they have the internet service. So there was, this outreach to service providers to make sure that we were able to provide internet service for our students whose families couldn't afford it or didn't have access or lived in a homeless shelter. We have a lot of students in New York City who are living in homeless shelters or are doubled up, which means that they're living with, multiple family members in a household. So providing access, and if you have multiple members in the household, you have multiple people who need access to that internet service at the same time, right? So in one household, you may have a student who's in pre-K, a student who's in elementary, a student who's in middle school, a student who's in high school, and they're all expected to do work at the same time for the same hours, right? And so that becomes difficult for students to manage because the household is loud. In order to really concentrate on your studies, a lot of times you need a quiet space, you need a space, right? And so if there's multiple people in a home at one time, it becomes difficult. So we saw students struggle with that. When you close schools, it also cuts off access to food, especially for families who have food insecurities, right? So breakfast and lunch, which generally is provided at school, that became an issue. So schools opened just in order to have students come to the building to get bagged breakfasts or lunch so that they still had access to food, because you also can't study and learn if you're hungry, right? Or if you're cold. And so addressing all of those needs that generally are addressed during the school day now needed to be addressed at home. On top of that, a lot of the caregivers, like we talked about, became ill. Grandma got sick and went into the hospital, and then who was home with the children? Children had to leave their households and go to another household because someone in the house was sick in the hospital, and they were there for a long time. And then some families lost that caregiver, right? They lost grandma, they lost grandpa, they lost several members of their family in a short period of time. So now you're also dealing with students who have grief and loss. And dealing with that when you don't have any physical contact with a student and you're just seeing them on a computer screen, as the months wore on, it became more and more difficult. When you close a school, a lot of schools have school-based health clinics, so you're closing that access. So programs, are important to be able to get those students the same type of services, to mental health, to medical care, to care for reproductive issues. When a school is closed, those resources close down for students. So it became just very challenging to meet the needs. And there were so many needs on so many different levels and so many different grade levels. And you had to, really have a team of, professionals that were invested in the students, that understood that, that could combat when, students, the isolation and the depression, and I don't want to turn on my camera. I may log into the class, but I'm not turning on to my camera because I don't want you to see what's going on in my home. It's too loud here. A lot of students, especially in high school, they had jobs. And so my job becomes more important now because I've lost, the caregiver, or I lost the breadwinner in my house. So I'm trying to provide for myself and for my siblings or for my family. And so I'm able to work. And if you're working during the day, you can't go to school during the day. So then making school more flexible where students were able to log on when they could. And a lot of times for a lot of our high school students, they were logging on to do schoolwork sometime between 10 p.m. and 1 a.m. in the morning, but at least they had access to their work. So they were able to, as much as possible, continue to have access to learning. So the losses, besides just the educational loss, the losses across the board for majority of our students were great. And, we're continuing to see, the impact of that in this school year. And then with Omicron, while we want to keep our students as safe as possible, closing schools, just has such impact across the board, that it's important for students to have, that access to school and to be able to go in person if they can. So there were great losses, but then there were also things that we learned about our students and connections that we were able to make. And, we were creative with proms and school pictures and allowing students to socialize in different ways with the drive-through graduation ceremonies, and those things that are really important, that we just realize that even though we couldn't do some of those things in person, they're important to be able to celebrate the successes. They're important to be able, to have that human contact. And I think what we also learned, especially, I guess, in my superintendency, is the importance of culturally responsive teaching and learning, right? And so you have to be able to make connections with your students. And in New York City, the population is Black and brown, and those are the students that suffered the most. And so, training our educators to be able to make those connections and that are offering learning on, on a cultural spectrum became very important for connection. And it drove student voice and allowed them to be able to express themselves the way that they wanted to express themselves and be true to themselves. And so I think those are just some of the things that we learned and that we have to continue. And so in this second run through with this pandemic and, where we are today, I think that we've learned enough to be able to offer kids, something different so that they're not as isolated, so that they can come to school. And what we've seen is even, with Omicron surging, students are showing up. They want to be in school. They want to see their teachers. They want to be with their peers. So I just think we have to capitalize more on the lessons that we learned and make it better for our Black and brown students. And then realize that, the socio-emotional and the mental health issues as a result of the grief and the loss and, the PTSD that, we are all suffering in one way or the other, that has to be addressed, in school. in the community. Like, it's important. And, even when we eventually get past this, like the lingering effects of this pandemic, I think we will see for years and years to come.
Can I ask you, Malika, how have the communications changed, that way you've been communicating with kids and around this? I mean, initially, I think maybe I might have dreamed this, but in our prep, we talked about, communications going to, the parents, but now, it seems like there's got to be more direct communication with the kids and support of the kids. Is that right? Around the vaccine, not the vaccines, I'm sorry, around COVID and Omicron and the whole thing. And have you changed the way you?
We have, right? So initially, during the first wave, I think one of the mistakes that we made is that we didn't get enough student voice, right? So we weren't talking directly to the students about COVID-19, about how it impacts the community, their specific community, Black and Brown communities, right? And so I think the messaging has changed, right? So we're openly talking about the impact of COVID-19, especially with, our middle school students and our high school students. You have to talk about it in a different way with the lower grades, but the middle school and high school students, and what does that look like in your community? How has that impacted you? How do you feel about the virus and what you've seen in the services that were taken away and what happened in this city, right? And then when you talk to kids about like the vaccination, right? Because, it is important, right? And we're saying it's important, but we were having those conversations with adults, right? And get your kid vaccinated. Well, students have opinions about being vaccinated, right? And so we really have to listen to what they're saying, and we really have to address that, like in class, in open discussion. What we heard in the beginning, and a lot of students believed it, and they were hearing it from somewhere, was that, oh, if I get this vaccination, it's going to change my DNA in some way. They're, putting a chip in me and they're going to be able to track me. I mean, there are a lot of conspiracy theories, but, and while we may have thought that they were silly, students believe those. And so you have to talk through that with students, and you have to hear them, and you have to, provide a way for them to work through it for themselves, right? And that they're making a decision about their health and their body, right? And so I think the first go around, we just didn't do that, and we've become much better at allowing that and doing forums in school where they're openly able to talk about it and to debate about it, right? And so you turn it into a lesson. It is education, right? And you have to hear the different voices and the different opinions, and then you guide and you help them make better decisions. And so that's become something that schools have implemented much better, I think, in this go around of the virus.
Do you feel like they're taking that information for both Dr. Diaz and Malika? Do you feel like they're taking that information, empowered with the information, back to their families and saying, yeah, well, let me give you some information that you might not know, and then, demystifying and mitigating any kind of other additional misinformation in the community? Do you feel that happens, that they, talk to their mothers, their fathers,
I do. And I think there's a lot of information that they're given in school about the virus. So right now what's happening is that, there's a lot of rapid tests, and there's the PCR testing programs in school, and the tests are coming home. And then you have to realize that a lot of our parents, their first language is not English. So they're relying on their children, for that information. And so it has become important, right? And they're talking to their parents about it, and they're helping their parents make decisions around it, and why it's important for not only them to be vaccinated now that they're eligible, right, but also for their parents to be vaccinated, and really talking about the things that scare us about the vaccine. And so you'll find people on various sides of it in school, but the conversations are happening where they weren't happening before. So I think that has been an important change and difference. And we're seeing parents we're seeing them at the vaccine sites, and we're seeing them bringing in the younger children to get vaccinated, and we're seeing them pick up rapid tests and doing the things that they need to do to try to keep their families safe. So I think the conversations have changed, and it's because of the students and the information that they're getting, that we're giving them, that they're able to take back and then talk to their families about.
That's great. Dr. Diaz, I don't know if you have anything to add to that in terms of families' engagement?
Yeah, it's like, we have always felt that family or parents are very, very important for young people, and they do better when their parents are involved. But we had a practice of working directly with a young person and, giving them the information, and then they can use that for themselves. We also have a peer health education program where we train teenagers, and then they go into their community and their friends, and they bring the correct information, and they really are wonderful to deal with myths and things like that. And a while back we had a program for young people used to come and exercise and healthy eating and all that, and one of the kids lost like 100 pounds. And then the family, the sister that was not in the program because she was an adult, lost 40 because he was taking the information home that he was learning and in healthy eating and how to cook and do, it's just wonderful because it really trickles into communities and families and things like that. We actually have full-time clinics inside 6 high school buildings, and through those we serve 24 high schools and middle schools. So, when the schools were closed, as Malika said, it was really hard because those clinics were completely closed. So there was no access. There was a decreased access for youth in general because the school-based clinics were closed because the schools were closed.
Do you both think, and any of you can respond to this, that this is going to be a crisis going forward for kids of more the mental health, well-being, social-emotional, long-term, or will there actually be, a physical health crisis? So some of the things that, Latoya mentioned in terms of long-term, long-haul COVID side effects in kids, or do you feel like this is really like the mental health is really the place where we need to be focused, mental and behavioral health?
I think it's both.
It's not a fair question. That's not a fair question.
It's absolutely both. It's absolutely both, right? I think, parents, children, like the long-term effects of contracting COVID-19, we don't know everything yet, right? But what we have seen for some people is that the long COVID and the impact to your health has been challenging, to say the least. And I think that it has significantly impacted mental health, right? Because feeling sick and being sick and having symptoms and, people not understanding that impacts your mental health. And we're seeing that. And I think that, the PTSD alone in this, also, I think the long-term effects, I think we'll see for, a generation. I really do.
And I agree with that. And we have to remember, even like the staff, the teacher, the providers, we are part of the same community. So the staff has also been affected. And at home, if the parents are not doing well because of COVID and because of the financial crisis and everything else, they're less able to hold their kids intact. So it affects that. So it's not only the direct impact on the kids, but also the fact that the families are being affected. So the family dynamic is different, and research and time we will learn much more moving forward. But I think I agree that it's multiple ways that it's going to be impacting young people.
And we also have to remember that not only did our children lose family members, but they also lost teachers and administrators in their school. People died, and and our students were connected to those teachers. And then now in this phase of the virus, we have teachers who are out at alarming numbers because they're contracting the virus and they're sick, and students are scared, right? Because you don't know.
You're on mute.
Muted.
Oh, so those connections that students had with the staff and faculty in school, that's been significantly impacted between the loss of life and also just with, the amount of teachers that are just out of the building because they're ill and unable to come back for long periods of time, and having new people. And at one point, during the pandemic, what we realized for our schools, especially for like high schools, is that a lot of, we didn't know the 9th and 10th graders. We had never seen them in person, right? So for a lot of those kids who, were 9th graders when the pandemic started, like this is their first time actually in the school building, right? And so that loss of like community and connection, is something that we can never give them back. And so there are principals that are saying, I don't know my 9th grade. I don't know that 10th grade. Like I don't know these kids where they would know everyone's name. They just knew them, as a box on a computer screen. And so that has been, also difficult because you have to now incorporate those kids who, didn't have that freshman year, didn't have that sophomore year in high school, and what that does to them, right? It's a loss that we can never give them back.
Yeah, and I think we'll be looking at these long-term impacts for years to come. Just seeing how the academic loss impacts children over time, how the financial losses impact families over time. We know Black and Hispanic families have less money in savings and it's harder for them to bounce back from a financial crisis. So this is something we'll be looking at for years and years to come, to just see all the different ways these disparities and impacts of COVID have changed lives.
It's very sobering. It's really sobering. I don't know if, I'm just going to pause here for a second. I'm not sure if we have any other questions. We did have one question come through for Dr. Diaz, and that looks like in the chat. Ronzetta, can you see it? Because I can't, for whatever reason, it's not doing what I need it to do. Let me see. Wait, there it goes. Okay, during the pandemic, it seems that young people between 18 and 26 were also floundering and having difficulty accessing services. What ages does Mount Sinai Adolescent Health Center accept?
We actually, when the pandemic began, and that is true. I mean, that age group also had challenges. So when the pandemic began, our top age was 24. And the medical director actually wisely increased the age to 26 during the pandemic so we can keep them longer and have other people come in. And we are expanded also. So we went, both ways. And they can come here through their 26th birthday, until just before turning 27, from 10 to just before 27. And if they have children, we also see the children from birth, because most of us are also pediatricians. And they once they come, they love the place, and they are not just provided services, they are loved, they are nurtured, they are inspired. It's really something different. It's not your traditional biomedical approach of healthcare.
I want to go there.
There's a hand raised by Kenosha Lee.
Sorry, Chris, I'm sorry. Let me, can I ask you to unmute? Well, can I unmute you? Let me see. Oh boy.
Hello, can you hear me?
I guess you can. Hi there.
Good afternoon, everyone. I just want to say thank you to the panel and to the coalition. This is very timely, important information. And Dr. Diaz, I commend you for the scope of your program dealing with adolescent health. And I'm just wondering what impact, and I think you mentioned it a little bit, does it have on your workforce capacity? Because we see the pandemic's negative impact has heavily affected those who were vulnerable to begin with. And when I say that, I'm speaking of children and youth with racial and ethnic minorities, LGBTQ, low income and rural area, immigrant household. And just wondering, because last month, the Surgeon General released an advisory highlighting the urgent need to address adolescent or youth mental health as a national crisis. And just traditionally, with the stigma associated with mental health in Black and Brown communities, just wondering how can we better support the mental health of children and youth in all settings, educational, community, childcare, and clinical. So that was a question that I had. It's kind of twofold, workforce capacity and supporting the mental health of children.
Yes, so, there are not enough mental health services even before the pandemic. I don't think there's enough developmentally, culturally grounded services, even medically for Black and Brown people, but mental health is really, really bad. And since the pandemic, because the demand has grown so much, it's almost impossible to meet the needs. So we need to continue to help people get into the field, to more. We also need to think about how we serve the population. And there's really a continuum of mental health. Some in the community, in the schools, in all those type of settings. And something we had decided, because we saw I saw a pandemic coming. I saw a tsunami of mental health coming from what the youth were saying in the survey, but also when they came to see us physically. So we decided we were going to add a minimum of 10 additional mental health staff right away. But also because the staff are either sick or some have gone into private practice because they got set up with the telehealth during the pandemic, it has been a struggle. So, we lose some and we bring new people. And so it's going to be like that for a while. But I think that mental health is a true crisis. I think it was a crisis before. 70% of our youth before COVID, 70% have a history of trauma. And sometimes people don't provide those services in a trauma-informed, trauma-specific way that really meets the needs of the population. This is not about checking boxes or seeing a youth in 15 minutes for a physical. They need really care that take them in their totality as people, that really you get to know what are they thinking, what are they feeling, what are they doing. And with them in partnership, you help bring that transformation and giving them the resources and the support. And, with the population that we serve, that I mentioned, 94% Black and Brown, low income, many of them do not have health insurance, and 70% of trauma. The way we work with them, and because of the school system, most of our kids complete high school, and many of them go to college, or get over 50% of our youth end up 2-year college, 4-year college, or they go to graduate school. I myself was a patient in this clinic. I was a high school dropout. I was depressed as a kid. This is before COVID. This is just life. And this program really helped me get back together and heal as a person in the totality. And that's what we do, and that's what young people need. They don't need a Band-Aid. They really need glue. They need love. They need to be believed in, especially Black and Brown kids that sometimes all they see is negativity, rejection, and things like that. So even when they are late to the clinic, we see them. Because if they are late and you say, no, you're late, that's another rejection for them. And then they may leave. You don't know why that kid was coming, and they may not come back. So we just need to change our orientation, the way we think. It's not about us, it's about them. How can we best serve them and do whatever we can? And we have an integrated model, which I think in terms of mental health is probably the best way to serve them, because people come from medical, they're sick, they have a discharge, they have a headache, they think they're whatever they're coming, including homeless youth and young people who are being trafficked. If they have HIV or something, they will come in. And when we see them medically, then we give them a dose of the mental health. We engage them. We have thousands of kids getting mental health, really high quality mental health and services because of the approach. So we need to rethink. I always say, and I'm going to stop after this because I can talk about this forever. I always say the healthcare system in the US was designed by adults for adults. Then we try to feed the young people there, and when it doesn't work, we blame them. We call them non-compliant and hard to reach, when indeed what is hard to reach is the services, the way they are designed, because they're not about the people who need the service. It's about the institutions. and everything that comes with the institution that we don't need to get into that here.
Thank you, Dr. Diaz. It's very important to know that mental health is part of overall health. And so you highlighting that is awesome. Thank you.
Thank you.
So we have a question in the chat. So, and I think it's a good segue from that. Do you have any suggestions about what we need to do to ensure that COVID recovery funds are coming to New York, that are coming to New York State are funneled to schools to assist students with mental health challenges? Does anybody have a response for that or thoughts about that?
I mean, in the Department of Education, we definitely did see a significant increase in funding that came directly to schools' budgets from the federal government to address some of these needs. And so the way that it's been addressed is that, you know, there were social-emotional learning trainings. There was an increase in hiring social workers that were placed directly in schools. So the money is definitely there, right? We just have to use it correctly. I think there has been a commitment and an understanding that mental health is important and that we need to address it in schools. I think it started before the pandemic, because what I think we ultimately recognize is that the anger and the aggression that we, you know, see in students often, especially our Black and Brown students, is about trauma, right? And how do we treat that trauma? And treating that trauma is not by suspending the student, right? So there has definitely been a shift in the discussion and the policies and procedures, at least in the Department of Education, around really trying to understand that and getting services to the students that are not punitive, right? Because I think that was what we were doing before, you know, it was punitive. Now it's more about making sure that they have access to the school based health clinics, that that we have more social workers and guidance counselors in schools, that teachers and principals and administrators are being trained in a social emotional learning, and that there are, you know, places for students to go while in school, and that information is also given to parents and they're allowed to come in and participate in those trainings. And that even happened, you know, during the pandemic, because we were able to do more things virtually. So we were able to have greater access to parents because we were able to meet them where they were instead of requiring them to have to come into buildings. So, you know, we still continued even after, you know, it eased up a little bit to continue to have like these parent meetings, you know, virtually, and allowing, you know, parents to do parent teacher conferences virtually, and to have trainings and be a part of the PTA virtually, so that we have seen a significant increase in parent participation, which is important for, you know, student learning. But the money is there, it's being used. We can always use more. We have a lot of students in this city. We have a lot of Black and Brown students in this city. And, you know, we just have to continue to make that push and understand that, you know, trauma has to be addressed in schools. And then the trauma also has to be talked about in the community and with parents, right? Because if you're having the conversation in school, if you're not having it with the parents and it's not a part of the community conversation, then it stalls. So it's there, the money's there, it's being used, and hopefully it continues to be used in the right way for the things that students really need, that really will impact their future and, you know, make a change.
Thank you, Malika. So we're going to just move on. I've got about 20 minutes left. I did want to share a special video that Dr. Diaz shared with us. But as I'm pulling that up, teeing that up, the last question really is, you know, what needs, and you've answered it in some of your responses so far, but what needs to happen for Black and Brown children to have the best chance for success going forward? So we know the issues around vaccines and testing, everything. I think, you know, that's kind of a no-brainer. But, you know, are there policies that you're currently looking at? Advocacy, you're looking at advocacy areas of advocacy, or legislation that you are considering? So anyone can start. Or your approach. Latoya, I know we seem to always end with you, but maybe we can start with you again around, you know, how Kaiser Family Foundation sees it. How are you moving forward with this topic?
Yeah, and I can give kind of a high level thinking about this at a higher level. I think it'll be key to make sure that an equity lens is being incorporated throughout our policies, our programs, and also our data collection, not only to mitigate the burden of COVID on Black and Brown children, but also these broader inequities that are at the root. And so this includes, thinking about how we direct funding and resources to support communities and the programs that serve them, and also being able to amplify the voices of the community. And one way to amplify those voices is through data collection, ensuring that we prioritize data collection to document the circumstances and experiences of Black and Brown children, to be able to fully understand how the pandemic has impacted them, but also just their broader life experiences and circumstances, and to be able to use that information then to target resources and programs moving forward. I think one of the things we've seen during this pandemic is the lack of quality, consistent, comprehensive data, and how hard it can be to truly identify those disparities without that data. For instance, I couldn't talk about specifically how children in New York City are experiencing a disproportionate burden, because that data isn't publicly available. And so making sure that we not only collect that data, but report the data, so we can not only document the disparities, but then target the resources and programs to be able to try to mitigate these inequities.
Thank you.
I think we also have to just say enough is enough, in terms of the disparities, the disinvestments in communities, in certain neighborhoods, and really have a frame that is a justice frame in everything we do: racial, social, economic, sexual and reproductive justice, whether it's healthcare, education, whatever. We really need to change the frame. And what I mean by that is to really change the social condition, to say it's not okay in this country. I mean, it's not okay anywhere, but we're here. For us to allow what happened for children to go home hungry, to go to bed hungry, to kids who are, not to have the resources to have health insurance. I mean, I see them for free and I raise the money, but why should young people not have health insurance in New York City? Every young person, why should not they have access to health, mental health, oral health as a right? That's not a privilege. Who you are, your body, education, health, those things are rights. They should not be those that can afford and can get it. So we just really need to change and really we need to build a movement about how do we bring all these children, youth, and families to really get what they deserve, because they are human and they are not lesser than. We should not tolerate that. And just all together amplify our voices, go wherever, like I go to City Council, I go to Albany, I go to Washington, wherever we can go to and explain. And when you have the data, you can also use the data, but you also need the narrative.
Right.
Together, they are very powerful.
That's right. That's right. We got that today. Okay.
And I just want to say, I think that we also just need to get real that we have policies that are not implemented in Black and Brown communities. And we saw that, in effect this week with that fire in the Bronx, right? So we have policies that disproportionately affect Black and Brown communities because they are not, there's no one there to make sure that those policies are implemented, right? And so we talk about fire safety, but the same things keep happening in Black and Brown poor communities because those policies that we have, they're not implemented in our communities. And we have to be real about that. And we have to keep saying that. And we do need the data to be able to talk about that because, we saw these news conferences this week and we talked about, this happens disproportionately in Black and Brown communities and the fire door and the fire safety. but we don't see the same things in communities that are not Black and brown, right? So that their policies are there, but they're not being implemented fairly across the board for everyone. And we have to be real about that.
Thank you, Malika. And the only other piece of legislation that I will point to, and it was passed to us from our friends at HRSA, was just to keep an eye on the Build Back Better Act. And and I didn't even know this, which is embarrassing. There's a significant number of healthcare provisions in the Build Back Better Act that, of course, was voted on by the House of Representatives, but now sits with the Senate. But if it could get passed, and if it would, there's so much access to coverage that it includes. It looks to do some work around healthcare disparities, child maternal health, behavioral health. We'll have to wait and see sort of how this all gets through the Senate. So we can just keep hope alive with the Build Back Better program, but keep an eye on that. The last thing I'm going to do is just share with you a wonderful video. Dr. Diaz, I'm going to do the one with one of your students who got the vaccination, which I absolutely adore, because these kids, when you get a video, you get them in front of a screen and they seem to know what to do automatically. Right? So let's just share this.
You need the volume, no?
Oh, can you not hear? Oh, wait a minute. Oh, wait, hold on. See if I can't. Is it? Uh-oh, wait a minute. Hold on. Oh. Uh-oh.
Can you turn up the volume, Janera?
Let me see if I can turn that up. Can you hear it? Oh,
No.
Sorry, did I? All right, because I practiced this and it was working. Hold on, let's try it again. Wait a minute, hold on. Let's try another
Janera,
one.
you may have to pull up your volume on your actual computer. Remember, I think that's the laptop.
Yeah, I did. That's amazing. It doesn't want to. No, hold on. Can I do this? I got this yesterday. Sorry. Sorry, was it still too low? Was it still low there? I'm so sorry. What we'll do is we'll send this out with our email, thanking everybody for coming so that you all see it, because there are just so many of them. And I also encourage you, and I can send around the one that's on the kids who are talking about mental health and well-being. I think it's just wonderful to see that they've identified it, and they just seem so just so mature in terms of the way they speak. And it's nice to see kids like that. Really, really nice, because they could turn it inward and it could be very ugly. So, but they're getting the help they need. So that's wonderful. All right. So I think we are on our way to closing. So that said, I have a very short survey that I'm going to launch. Hopefully that works for us. And so if everybody will just participate in that short post-event survey. Let me turn it back over to Adina. Is Adina there to just close us out?
Yes, I'm here. Can you stop sharing, Janera?
I can.
Please? Thank you. Let me get back on camera. I was present. I just wanted to make sure you were able to see the presenters and not be blinded by me. But thank you everyone for participating in this wonderful presentation. Thank you to presenters for coming on here and and joining us on our very first 2002 kickoff presentation that we'll have in next for the year. But there are three things that I would like to make sure that every participant here knows about our program, and also in addition to completing the survey. First is I am adding 2 links in the chat. I hope everyone's able to see that. There are 2 important links. They're links to our website, NCBW Manhattan. One directs you to our events and the other directs you to our donation. The first one, the events, will give you a list of programs that we have scheduled that we would like for you to register. There are more conversations that we want to have and share in order to improve, in order to be aware of what's going on in our community. And so more events like this. So we would like for you to participate and invite others as well. So that's the first link. The second one is a link on donations. So here, you know, we are asking our viewers, you, the audience, to make a gift to the NCBW Manhattan chapter today. Your tax-deductible donation will provide the resources to help further our mission, especially for Black women and girls. But we can't do this without you. We need you to donate. And to do that, you'll go onto our website through that link. And then the last message is, big one, the survey. So the survey, I believe the link, did you send the link, or are we?
Oh, this is for the, you ready for the launch? I'm launching the poll now. Short,
Okay.
4 questions.
Mm-hmm.
All right, let's.
So please answer the survey, the link, the survey, so that way we can see what we need to improve, what you found enjoyable, what we need, and we'll just, this is something that will help make our coalition a bit stronger and understand how you, the viewers, are taking in the presentations that you've witnessed and participated in. So thank you. I'm going to pass this back to Janera or Madam President. I don't know if she wants to say some last words.
Yeah,
So,
I don't know. Yes, Nancy, did you want to say anything? Did you have anything to offer? Or if there are any final comments from our speakers? I've put the campaign videos in the chat as well, so that that's something you can take with you right now, because they are great, really, really great.
I want to commend the Health Committee for putting together a phenomenal program. One of the questions in the chat, I put down, 50% of the stuff I knew and didn't. So I think definitely that this program, especially this year, we'll see if there's a part 2 and we can extend it, because really I learned so much, and great job kicking off our program year. Thank you, Health Committee.
Wonderful, wonderful. And it looks like, all right, looks like we are, I think we're at.
So I just want to let you know also that if you want to copy what's in your chat, there should be a file button on the chat box. If you click on that, you'll see an option to download the chat. So that way you can click on some of these links later and you have that readily available or accessible on your desktop. So just giving you that tidbit of information.
Okay.
Anywho.
And thank you so much all for, again, I'm going to stop sharing that. The survey, which were very good. Everyone had really, really hard marks for this. They loved our speakers, and we love the fact that you stuck with us. This will be available, I think, on Facebook, and we will have the recording and place it, you know, in a public domain so that others will be able to take a look at it. So this isn't a one and done. Again, to Nancy's point, we're going to continue on with this. This is not going away. So thank you so much. I give you back 5 minutes of your evening. We were supposed to go to 8:30. Have a great evening. Thank you so much to our speakers. Fabulous, fabulous, fabulous job. Great discussion. Thank you for participating. And have a good night, ladies. Have a good night.